Give yourselves a big clap. Now, I know that you've all had, or some of you have had a tour of the Community Chef Kitchen, and I've heard great comments and feedback from that. But Hayden Raysmith, who is the Chief Executive Officer of the Community Chef Kitchen, is now going to present. He holds an honorary position of Chair of the Abbotsford Convent Foundation. He's the Ambassador for the Melbourne Community Foundation, Chair of the Hobsons Bay Community Fund and Governance Patron of the Victorian Local Governance Association. As an independent consultant, he undertook a review that led to the establishment of the current primary health care system in Victoria, and more recently set up the Neighbourhood Renewal Program and advised on place-based strategies, social enterprises and social inclusion. Previous positions that he has held included Executive Director of the Victorian Council of Social Service, the peak body for community sector organisation, and Director of Public Health and statewide operations with Victorian Health Department. Welcome, Hayden.
In active and caring communities, good ideas often emerge around someone's kitchen table. Clever people take that idea and build on it and make it happen. If it proves to be a good idea, it then grows and it also adapts over time according to circumstances and advances in technology. We know that Meals on Wheels originated in the UK when the Women's Volunteer Service for Civil Defence prepared meals for servicemen and civilians who'd lost their homes and kitchens during the bombing raids. This idea was picked up in Australia in the 50s and the 60s, gradually evolving into well-organised services that became funded by both state and Commonwealth governments under the Delivered Meals Subsidy Act. That was in 1970, and then later that was incorporated into the Home and Community Care Act of 1985. I actually go back far enough in my involvement with local governments and with Meals on Wheels that in 1970 I was part of a discussion relating to the introduction of that first act, and also worked with Edith McCallum, the late Edith McCallum, who was the first social worker appointed in local government in Victoria and was at South Melbourne, the late South Melbourne. It's now incorporated into the city of Port Phillip. So I've understood and seen the development of Meals on Wheels since its very early period here in Victoria. Over this period, meal numbers grew and food safety standards were raised. Dietary guidelines improved and production kitchens changed, in particular to offer more variety and to adopt to the cook-chill technology. At the time, that was quite controversial, and some of you may remember it. In Victoria, local governments have been the provider. This has had three significant advantages. It provided a universal delivery platform that could be linked to state government policies and funding. It was able to integrate delivered meals with other community and aged care services, and it provided another level of subsidy and support for the service. State government policy that was introduced in 1994 amalgamated local governments and introduced compulsory competitive tendering. Some councils, such as Hobsons Bay, used this as an opportunity to expand their kitchens and become a provider to other councils under what became known as the purchaser-provider split. But many more contracted their meal preparation out to the private sector. Delivery to the door remained a council role, but there was a move to use paid staff rather than volunteers under this role. Shortly after winding back compulsory competitive tendering in 1999, councils began sharing their concerns about delivered meals, both in relation to their own services and those contracted out to the private sector. In the case of those with their own kitchens, The question was whether it was core business for local government, whether the exposure to risk was prudent, and whether they had the capital to continue to upgrade their kitchens to meet food safety standards and new production methods. In the case of private outsourced contracts, concerns were more broadly based. A survey undertaken in 2004 revealed that some councils had been unable to get any private tenderers for their tender, and where there was only one tenderer, there was no price competition. Other concerns were the inability to meet diverse needs, limited menu choice, lack of specialist meals, meals that did not meet HAC standards, and uncertainty of supply. By 2005, 15 local governments had joined forces to fund a feasibility study for a local government regional food production facility. This study concluded, and I quote, "The construction and operation of a regional food production facility by a consortium of councils is considered feasible," end of quote. By December 2007, 14 local governments signed a shareholder agreement to incorporate RFK Proprietary Limited. Community Chef was born. 2 years later, the number of shareholders had grown to 20, stretching from Surf Coast and Greater Geelong to Macedon Ranges and Greater Dandenong. For the record, 6 still operated their own kitchen, 4 were supplied by Hobson's Bay, and 10 were outsourced to private suppliers. Reflecting another change, only 2 of the 20 exclusively used volunteers to deliver the meals, 9 used paid staff, and 9 used a combination of paid staff and volunteers. Let me then turn to meal production. Community Chef manufacturing facility now exists at Drake Boulevard, Altona, and with 20 council shareholder customers. And 160 of you here today have been and seen that facility. They own it, those 20 local government shareholders, they literally own that facility. It commenced production on the 1st of December 2010, and it produced 4,000 meal items on its first day, and now has escalated that to 16,000 meal items a day. Just over 1/3 of Victoria's total meal requirements for Meals on Wheels. The venture has been driven by the desire to provide a varied menu and high-quality meals that meal recipients will enjoy and which will contribute to their long-term health and well-being. Meal recipients have been involved in the process from the beginning and continue to sample new recipes and contribute to menu change. Within the facility is a specialist meals kitchen, which also is used for research and development. 216 recipes were developed and independently validated for the summer menu, which created 166 meal choices. Even for those who chose to eat roasts every day, and those of you who deliver Meals on Wheels know that many older people love their roasts and would have them every day, there are 8 different varieties of roasts. Vegetarians have a rotation of 20 different options, whilst those preferring Asian dishes have a choice of 28 different meals. Each day the menu has 6 meal choices: Anglo, Asian, international, vegetarian, roast and salad. A meal is made up of soup, main and dessert, with councils adding their own extras such as juice and fresh fruit. Diabetic, low sodium, low fat meals are catered for within the main menu range, whilst halal, kosher and sandwiches are sourced externally. 11 vegetable side dishes are produced separately to allow for maximum choice and the ability to mix and match with the main courses. For those requiring texture modified meals, they can be provided in 3 forms: cut, moist and mashed, and pureed. The economies of scale enable many special meals to be offered within the main menu range, such as roast without gravy or dessert without custard. New menu items are added seasonally, with chefs working all year round on the research and development. Every new meal and recipe underpinning it must be validated by an independent dietitian and also be validated through the cooking and pasteurising process to ensure that it meets required standards. New meals, therefore, have a long lead time, but this also provides the opportunity to engage with meal recipients and our customers, the 20 local governments. The accredited practicing dietitian that validated the summer menu range was Chloe Fast from Melbourne Diabetic Centre. And to quote, she said, "The community chef's summer menu is exceptional, providing clients with a variety of lighter meal options as well as traditional hot meals, both of which are appealing to the client group. The menu is innovative, well presented and appropriate in serving size. The appearance and nutritional quality of the meals are integral to the mental and physical well-being of home and community care clients." Celebrity chef Gabrielle Gattei, who is also our patron for Community Chef, said, "I have tried the meals now being produced from the new kitchen and found them to be tasty, nutritious and very well balanced. The range of choice is amazing and they live up to the expectations I had when the recipes were first being discussed," and they were discussed with Gabrielle.